syphilis. Syphilis is a chronic infectious venereal disease with a long history that dates back to the late 15th century when it reached epidemic proportions in Europe. Despite medical advancements, it still poses a significant public health concern, with approximately 25,000 new cases reported in the United States each year. Syphilis can lead to severe health complications and even death if left untreated, making it crucial for us to understand this disease. Syphilis is caused by a spiral-shaped microorganism known as Treponema pallidum, which was identified in 1905. This microorganism spreads through sexual activity and quickly enters the body's systems, affecting the mucous membranes, lymph nodes, and bloodstream. While it cannot survive for long outside the human body, it can be transmitted from person to person through sexual contact. Classification. There are two main classifications of syphilis: acquired and congenital. Acquired syphilis is transmitted through sexual activity from an infected partner to an uninfected one. Congenital syphilis is passed from an infected mother to her unborn baby through the placenta. Stages of the disease. Syphilis is typically divided into 4 stages. 1. Primary stage syphilis. This stage is characterized by the appearance of a sore called a chancre, which usually occurs 10 to 90 days after contact with an infected individual. The most common locations for chancres are the genitals and anus, but they can appear in other areas where the infection entered the body. The chancre is painless and may heal in about 4 weeks, even without treatment. 2. Secondary stage syphilis. If primary syphilis remains untreated, secondary syphilis may develop 1 to 8 weeks after infection. This stage exhibits various symptoms, including skin rashes, mucous membrane lesions, fever, and other systemic issues. It is often referred to as the great imitator due to its diverse and fluctuating signs. 3. Latent syphilis latent. Syphilis has 2 substages: early latent within the first 2 years after initial infection and late latent more than 2 years after infection. In this stage, the patient may have no physical signs, but can still carry the infection. Late latent syphilis may lead to tertiary syphilis if left untreated. 4. Tertiary syphilis. This is the final non-infectious stage of syphilis, associated with severe complications such as gummas, lesions on skin, bones and organs, respiratory and cardiovascular problems, and neurosyphilis is infection of the nervous system, which can result in paralysis, insanity, blindness, and death. And death diagnosis. Diagnosing syphilis involves taking the patient's history, conducting a physical examination, and performing laboratory tests. Various tests, including the fluorescent treponemal antibody absorption test, the Venereal Disease Research Laboratory, also known as VDRL slide test, and the rapid plasma reagent or RPR test can help confirm the presence of the disease. Differential diagnosis. In cases where syphilis symptoms overlap with other diseases, a differential diagnosis is essential. This involves systematically comparing and contrasting the signs and symptoms to determine the correct disease, as syphilis can often mimic other conditions. Treatment. Effective treatment for syphilis in its primary or secondary stages usually involves a single injection of penicillin. Late-stage syphilis may require a more extended course of treatment. For patients allergic to penicillin, alternative antibiotics such as tetracycline or erythromycin can be considered. It's vital for patients to complete their treatment even after symptoms have disappeared. Lesions in secondary syphilis should be kept clean and dry, and late syphilis symptoms should be treated promptly. Patients should also have regular follow-up testing to detect any potential relapse. Furthermore, individuals with syphilis should inform their sexual partners to ensure they receive testing and treatment, as this may be required by state law. Understanding the stages, diagnosis, and treatment of syphilis is essential for healthcare professionals and the public to combat this serious disease effectively. Syphilis is a preventable and treatable condition, and timely intervention can make a significant difference in the health and well-being of those affected by it.